Hi, I'm Janet Holtz. Welcome to the Be Well Now Method podcast. If you have heart disease or you're at a higher risk for developing heart disease, you've likely heard the advice to exercise. Exercise, when done well, is known to reduce the risk of heart disease or having a second heart event. That's because it can reduce the risk factors for heart disease like high blood pressure, high cholesterol, diabetes. It improves heart function. It reduces the risk of having a second heart attack if you've had a first one. It also helps with weight management and it lowers stress. However, the recommendations to exercise and the pressure to do it consistently can cause stress. You might worry about having another heart attack by pushing too hard or doing it wrong. You might stress out about finding the time or knowing what to do or how to do it without injury. Mentally, the I know I should mindset hanging over your head can keep you in a chronic stress state, which is not helpful for heart disease. The Be Well Now method is an evidence-based approach that takes the stress out of exercising with conditions like heart disease. So on this episode, let's go over how to use this method to take the stress out of exercising when you have or want to prevent heart disease. I'll show you how to turn the worry about the risk of disease that keeps you in survival mode into a way to exercise that restores your whole person confidence and your ability to thrive, not just survive with heart disease. Why? Because that stress state is the hinge point for health. That's when energy goes away from healing, growing, and learning and into fighting, fleeing, or freezing against a threat. But when you have a chronic illness like heart disease, the threat is your body or your risk factors or your family history. And when you're living with a threat, it keeps you in chronic stress, taking energy away from preventing or treating disease. So we want exercise to shift you into the well state where healing and growth and learning happen. This gives you the greatest power to lead your own well-being. Only you can make this shift in your cells, in your physiology, from the stress state to the well state. And only when you know how to use exercise well. This Be Well Now method allows you to take a very gradual step-by-step approach rather than diving into exercising to pause and make sure that you are exercising in the well state from day one, from the moment you think about it. So even thinking about exercise doesn't put you in the stress state, but it puts you in the well state. And so this is what it means to be exercising well. Moving beyond just exercising to check the box to say you did it, or to do it as a way to battle a disease, because those mindsets keep us in the stress state. Instead, we want to think of exercise as a resource to be well now. Here's how to put it into action when exercising to prevent or treat heart disease. First, the B step. This is the presence principle, to get in the present moment. When we're trying to beat a disease or prevent a secondary heart event, we can be very future focused and fear of the past and fear of the future. The B step is there to remind you to get to the present, to notice, okay, what are those thoughts? What are those fears? What are those emotions that are happening right now as you think about this disease? The moment that you hear the word heart disease, whether it's you've had a heart event or you're at high risk for heart disease, a thought creates an emotion and that emotion changes your body and that can put you in a stress state and keep you in a stress state. So we want to rewire that and rewire it so that you feel confident. And so we start by just noticing, just awareness of what are the thoughts, what are the emotions, what are the fears, what's everything going on when you hear the word heart disease related to yourself and your health. Just write it down. Write down everything that you think about. Just brainstorm. This awareness is the first step to change. But our brain has this negativity bias. Now we want to balance that with what's going well right now. We want to be able to see both ends of the spectrum. Okay. So I want you to write down what is supporting you right now. Maybe you have a doctor who's very helpful or a healthcare provider who explains things to you, or you've seen a dietitian who's clarified some information for you, or you have a family member who's supporting you, or you're on a medication that's making you feel more supported. Or you're doing something already that you feel is supporting your health. Write down everything that you're doing, anything you're thinking, any mindset that's helpful. Write down everything that is supporting you right now. Okay. Pause and take a moment to do this. This is your chance to do this. Okay. So look at that balance between what the challenges are and what the supports are right now. And just notice that you have both. And now I'd like you to close your eyes or just look down at something and take a little pause. Go inside and just feel your breath. Just feel that your breath is moving in and out. There's nothing you have to do. Let your body find a position where it can rest. And let yourself get into the present moment, feeling the fact that you are being supported right now, that your body is hardwired for you to not only just survive, but to thrive. And your breath is evidence of that. Your breath comes and goes. There's nothing you have to do to make it happen. Just feel that ebb and flow of the breath. Your heart is beating, your lungs are breathing. And just notice how your body is taking care of you right now. All the ways, right at this very moment, your body is taking care of you. It is supporting you. And now you are supporting your body. You're taking this time, this moment to listen to what only you know inside about how to shift from the stress state to the well state. And then expand that awareness to your center and notice what's important to you right now about this. What's important to you right now about heart health, about preserving how you feel and function and preserving your health? Why does it matter to you? Just notice what you know in your center, beyond your thoughts, beyond the shoulds, below all of that. What do you know about what's most important to you about this? And then let that awareness expand to your whole body and just feel where you might be holding some tension. And then let your body move in some way. That movement is there to help your body release this ready to move tension of stress. Just that tension is just your body ready to move. Give it some movement. That might be a gentle massage. It might be a big stretch or just some really gentle movement. You might squeeze and release your body. Whatever allows you to use up that ready to move tension and then let your body dissipate it a little bit. And you have brought yourself into the well state by noticing, by listening, and by moving. And so let your eyes open if they're closed and keep this awareness in your body, this trust that your body knows what to do. We're just giving it some guidance. So now that brings us to the well step. Now that we're in the present moment, we're fully aware of the challenges and the supports, and we're physiologically in the well state, then you can use that state to get really clear what's important to you. So before you dive in and all those things that you've been told what to do to prevent or treat heart disease, all those to-dos, we're not going to start doing those yet because they can really just add to stress. We want to really be choosy about those to-dos and which ones to do first. And your core why is the way to know that. Your core why is what's most important to you. It's your why, what you value most, what's most important to you. But that core why is what you know in your center, in your heart and your gut brain, this center of your body, not all the shoulds hanging out in your head, right? We want to get below the surface of that to what you know is most important. I find it helps to think of it as I want to keep my heart healthy and strong so I can, ... How would you finish that sentence? Just brainstorm. So I can. List all of the things that you will be doing and why they matter to you. Again, pause and write that down. I promise it will be worth it. And then step 3, now what do you do? Well, you take that information about what you know right now. What are the challenges? What are the supports already working? What's important to you? And we turn that into action that gives you the best return on your investment for you personally. This is personalized with the stuff that only you know inside. But this now step with exercise ensures that the way that you're moving and your approach to exercise aligns with the principles of movement science. So your body is moving with the most strength and the least strain, and exercise science, that you're exercising in a way that has the best chance for keeping you in the well state rather than triggering the stress state. Okay. There's some very common ways that we exercise in the stress state. More is better, all or nothing, no pain, no gain. Those all trigger the stress state. They're not going to help us to be well and certainly not help us be healthy. So let's follow the principles that really get us away from those mindsets that are not helpful at all and make exercise stressful. This is the positive experience principle, and it's very rooted in movement science and exercise science. And you won't always hear these principles. You'll often hear the opposite of them. So I really want you to know the principles of movement and exercise. We start with the principles of moving well. There are 3 principles of this based on biomechanics and physics. There's a link to a video below to teach you or guide you through learning or relearning, really, because we're born with this, how to move every movement with these first 3 movement principles, these foundations. The first one is finding your natural alignment. The second one is using your core to support you. And the third one is hinging. So check out that video below to experience what it's like to move well. And then we follow the exercise science principles, which mean that we want to do this in a way that aligns with the way your body can get stronger. And first, we want to think about what to do, right? What are the types? Specificity is one of those principles. We look back at what you're doing, what's important to you, and we make sure that you're doing the specific types of movement that are going to give you that. There's 3 categories of those, and we need all 3 of those for everything that you put on that list that you want to do. We need mobility, we need strength, and we need stamina. You'll hear the most about cardiovascular exercise for heart disease. And yes, that is a very important type of exercise when you have heart disease. However, our body does not only need cardiovascular fitness or stamina, it needs mobility and it needs strength to be able to do that and to do all the other stuff that you need to do in everyday life. So we want to think about this word exercise as having 3 parts: mobility, strength, and stamina. Okay, so that's one of the principles. Another principle is gradual progression, though. So you're going to hear, okay, get 30 minutes of this, do strength twice a week. You're going to hear these recommendations. Those recommendations are guides. They're not the end all be all, and they're not the place to start. Okay. Oftentimes when you hear those recommendations, you won't hear that you need to start somewhere lower than that. We talk about that as the end goal, get 10,000 steps a day. But if you're doing 2,000 steps a day, our body can adapt to about a 5 to 10% increase per week. That is not very much. So if you're doing 2,000 steps a day, the 10% of that is 200 steps a day, right? It's not much. So I just use that as an example beyond getting steps and just increasing physical activity, because there's so much more to it than that. You deserve more. Your body needs more specificity. It needs more specific instructions about how to move and age well. So the first one is mobility. Okay. So mobility is stretching and balance. Mobility is freedom of movement. What allows you to be free to move? Well, we want to reduce that inflammation that causes stiffness, and we want to have a little balance and agility so that you're not worried about falling when you're moving. Mobility is best built in small doses in little bits throughout the day. Okay, so we can increase mobility, but when you add mindfulness to your mobility, then it becomes a moment to get out of chronic stress and bring stress back into a cycle. So every time you pause to do a mindful mobility moment, doing some stretching, maybe a little playful balance exercise in the middle of your day, maybe when you put something in your microwave, or you go to the bathroom, or you get out of bed, or before you go to bed, these little moments of the day help to get you out of the stress state, back to the well state. Then you'll have some stress. You'll go back in the stress state. You can do another mindful mobility moment. And this is how exercise can reduce what we call sitting disease. Okay. You'll hear sitting disease is really a cardiovascular risk, but it's not a disease to sit. It's not a problem. The problem is that it raises inflammation when we're stressed and still. Mindful mobility moments cure the stress state because they get your brain back in the present moment and they get your body to clear that ready to move tension. Okay. So taking mindful mobility moments is one of the best things that you can do to reduce the risks of heart disease and reduce the strain on your cardiovascular system. Oftentimes, this type of exercise is not very much recommended as a type of exercise for heart disease, but I can tell you from a physiologic standpoint, it's one of the best things you can do. And I find it's the easiest way to start. So you might start here just taking mindful mobility moments throughout your day to clear the stress state from your brain and body. Okay. The second type is strength. There's lots of ways to practice strength. Many of them will improve your strength. However, that specificity principle tells us that when the movements that you do mimic the movements that you want to do, then your body is going to get stronger. And motivation science tells us that when what you do has meaning, it's going to be more intrinsically motivating. So when the strength movements that you're doing are mimicking the movements that you want to do in everyday life, that you need to do in everyday life, like lifting something overhead or climbing stairs or getting out of a chair or picking something up or pushing a heavy door or pulling something. Those are movements that you need strength for. So why not practice those in strength training? So this is functional strength, or I call it whole life strength. These are movements that we need to do for our whole life, and you can do for your whole life to stay strong for your whole life. So whole life strength is doing them mindfully and starting at a level that's a muscle memory level. So meaning a light level where you're not really lifting resistance at all, no weights at all, just doing the movements mindfully to ensure that you can do them pain-free. This does a couple of things when you have heart disease. One, it makes sure that you're not straining your system. If you have heart disease, sometimes you have chronic pain that goes with that might limit your movement. So it allows you to start in a pain-free or pain-reducing range, and you will never be sore from strength exercises. You never have to be sore. So this ensures that you're not sore, which means your body's going to tell your brain, hey, you can do this. This feels really good. And I know it's going to make you stronger for the things that are important to you. So let's keep doing this. So motivation works better. Your body works better. So a slow, gradual progression, movements that are functional of everyday life, and at a level that doesn't cause soreness, because soreness is inflammation, and we don't want inflammation in your body. That's the precursor for heart disease. We want to lower inflammation, not raise it, even in the beginning. Okay. So doing these with strength, not strain, and gradually progressing. As you progress, ensuring that you're whisper counting, not holding your breath. Holding your breath is listening and grunting and holding your breath when you're doing strength exercises. That puts strain on your heart. We don't need to do that. So when you do a slow, gradual progression, practice whisper counting, just counting out loud and whispering 1, 2, like that. And that'll make sure that you're breathing as you're doing the exercises so you're not holding your breath, and make sure that you can do the strength exercise as well. Now, strength has been very connected with cardiovascular health because we know that most of our movements in everyday life involve moving against gravity, which is strength. So we don't just want cardiovascular fitness, we also want musculoskeletal fitness, but in a way that's going to keep you moving well in everyday life. When you do that, climbing the stairs with laundry, lifting something up, getting up off the floor is done with much less strain and stress, minimizing the strain on your cardiovascular system when you're moving in everyday life. Okay. And then the third type is stamina or cardiovascular exercise that improves your cardiovascular or aerobic fitness, or in other words, stamina. I call it stamina because that's what we want. We want more lasting energy. Cardiovascular fitness is kind of this external measure. But whatever you call it, it's stamina or cardiovascular exercise. Some people call it cardio, but I like calling it cardiovascular or stamina because you're increasing the strength of your whole system. Okay. I had a patient once who had a heart that needed to be replaced. She was in her 30s. She had cancer, and the cancer treatment affected her heart years later, and she needed a heart transplant. Her heart needed to be replaced, but she started doing exercise and the rest of her body improved. She was able to improve stamina, even though her heart was not really able to get stronger. The rest of her body got stronger. Her blood vessels got stronger. Her cells in her muscles got better at producing energy aerobically. So cardiovascular reminds us that it's not just your heart you're strengthening. It's the whole vascular system that's getting stronger when you do cardio. So that's what really improves your stamina and keeps your cardiovascular system strong. So just know that this cardiovascular system is really resilient when you know how to move it well. So we do some type of exercise where you're moving continuously, like walking. Dancing is great. Biking, swimming, something you're moving continuously at a moderate to light level for your breathing to start. So your breathing is just barely noticeable, just comfortable. You can gradually move up into a comfortable challenge level. But if you go to a level for your breathing that makes it stressful and you start worrying, then we're losing the benefits. Okay. So choose the intensity and the type of cardiovascular exercise that you're doing that makes your body feel and function better right away as you're doing it. Not painful, not stressful, and not worrisome that you're going to damage something or you're going to have a heart attack. Keep it at a level that's light to moderate to start. Bump up into comfortable challenge for your breathing, and do it in a way that feels good. Okay. If you have had a heart event, I encourage you, I recommend going to cardiac rehab if you have not already. It is designed to help you regain that confidence and be monitored and get to know your body and how it functions well. And you'll learn a ton and you'll meet people, and it's just a great experience. I've worked in cardiac rehab for many years, and I saw how it really helped people who are very worried after a heart event. So if you can at all attend cardiac rehab, most insurances will cover it. So the 3 types of exercise are 1 time a day, practice mindful mobility moments, twice a week, practice functional strength movements, 1 to 3 sets, 8 to 12 repetitions, upper body and lower body movements, using your core as designed while you're doing those upper body and lower body movements. You'll learn more about that in that video I linked below that mimic the movements of everyday life. Okay. And gradually work up to that. And then 3 times a week, for anywhere between 5 and 30 minutes, practice cardiovascular exercise. You can do that in small bouts and accumulate 30 minutes, but start with maybe 5 minutes. Start with what feels really easy. Gradually work up to 30 minutes, 3 days a week, but you can do that in smaller bouts, 10 minutes, 3 times a day, 15 minutes a day. Work up to the level that feels comfortable for you, not stressful. Okay. The key is using a flexible progression mindset. What does that mean? That means that your progression is not going to be linear. It's not going to be every day you do a little more. And if you can't do what you did more than you did the day before, then you're failing and you're going backwards. That's not true. Progression is going to be more of a wavy line because life is variable. Your body is variable. Things are going to happen that will take your energy, and you'll have to back up a little bit, and then you'll build up again gradually. What matters most is that you're doing this consistently and you're doing it in the well state, not in the stress state. So if the lack of progression is causing you stress, it's not going to help. Use this flexible progression by listening to your body. If it's allowing you to feel and function better now, if it's getting you out of the stress state back to the well state, it's working. Okay. So to summarize, follow the 3 steps of the Be Well Now method. Meet yourself where you are, noticing both the challenges and the supports right now. Well, the second step is clarify your core why and use that as a guide to know what to do, what's worth your time. And then 3, move well. Now take the time to really intentionally set up exercise to have mobility, strength, and stamina in a way that shifts you to the well state with a slow, gradual progression at a level that allows you to feel and function better now. Okay. So listen to your body, make this a habit, but most importantly, take those recommendations with a grain of salt and add in what you know inside to gradually get to the level that works for you. Okay. Let's bridge this gap between the exercise recommendations for heart disease, whether it's prevention or treatment of heart disease, and life-giving exercise habits that keep you in the well state. Exercisingwell.com has lots of resources for you for how to exercise in the well state. Lots of information about exercise science, movement science, motivation science, mindfulness, how to put them all together so that you can exercise to be well now. Go to exercisingwell.com to learn more. Thank you for being here, and be well now.